tuvimos una conversación muy productiva con líderes de todo nuestro sistema universitario local y con otros líderes del condado para hablar sobre la crisis de COVID que estamos viviendo otra vez. Hablamos sobre cómo podemos trabajar juntos en las próximas semanas y meses para vacunar a los estudiantes y también los empleados y promover un comportamiento más seguro. Muchas gracias. Excuse me, we've also just been joined by Dr. Peter Page, our Chief Medical Officer, and we'd like to hear from Dr. Page next. Thank you, Natalia.
Good morning, everyone. Very exciting day as we started this collaborative with the leadership of some of our major educational institutions across the county. As we look at our current state, we obviously are continuing to see an increase in hospitalizations related to COVID. The state rate for positivity most recently has been designated as 18.1%. The county rate has been 12.1%, up the last 7 days to 13.46%. The median age of the positive cases is 36, which obviously is a different scenario than we were experiencing last year. I do want to emphasize that the majority of these patients that are hospitalized are the unvaccinated. Many percentage numbers are giving a range of 90 to 95% across the state. And obviously some of the immunocompromised and immunosuppressed comprise a certain percentage of the unvaccinated that are in the hospitals currently. I will say there is some positivity in our vaccinations program across the county. We have seen an increase in vaccinations, first dose, since July 21st. We've actually seen almost a doubling of our daily average of first dose vaccinations, which is a positive sign. And I will say from the state perspective, we have seen the last 2 days, there's been a slight decrease in new cases per day since we've entered August, but the hospitalizations continue to increase. 21% of our hospitalized patients across the state right now are requiring critical care services. And on another positive front, we are seeing a very low rate of transfers from nursing homes and long-term care with COVID to the hospitals. The rate currently is only 2.7% of the inpatient hospitalized populations with COVID. That's probably largely reflective on our targeted vaccination campaign across the county and the state for the older population as well as the vulnerable population. So currently, the latest data has the county having about 78% of their residents having received at least one dose, 12 and over, and for the state it's 61% for the same population. Obviously, some of these numbers, because of, we're an international destination, we do have people who come in and out, so some of these numbers may, in reality, be a little bit lower. But the vaccination campaign for the county has been a great success story at this point. We just need to figure out how to get the rest of the unvaccinated into the vaccinated pool.
Thank you very much, Dr. Page. We're gonna open the mic now for President of Florida International University, Mark Rosenberg.
Yes, good morning. Thank you. And thank you to the mayor for bringing us together. Clearly for educators and everybody who's concerned about our community, this Delta virus is the challenge. It is the enemy. Collaboration is key. And we will work very closely with the county to ensure that there is even greater availability of the vaccine for our students. We strongly recommend that our students receive the vaccine as a state institution. We do not require it, however, but we are sure that many members of our community will benefit from the greater availability of the vaccine, and we're eager to begin this initiative. Para nosotros, la enfermedad Delta es el enemigo claramente. Obviamente es clave la colaboración entre nosotros como entidades enfocadas sobre nuestros alumnos. Para nosotros en la FIU, se sugiere que se recibe la vacuna, no se requiere, y obviamente podemos acelerar la disponibilidad de la vacuna, ya que hemos ofrecido 14,000 dosis, pero hay muchos más que son elegibles si se escoja la oportunidad. Con tal de que estamos con el condado para asegurar que este esfuerzo tiene éxito. Gracias.
Thank you very much. And now we're going to hear from President of Miami-Dade College, Madeline Pumariega.
Thank you, Madam Mayor, for convening us and for my colleagues at Miami-Dade College. We remain committed to keeping everyone informed on our campus and making sure that we keep everyone safe on our campuses. With the recent increase in the COVID-19, especially the Delta variant, we are especially committed to making sure that we provide vaccination opportunities for our students, faculty, and staff. We have done so through the North Campus. We were recently a federal site where we administered over 350,000 vaccinations. We remain committed in partnering with the county. The Miami-Dade College North Campus is a county-run site, and we do daily vaccinations there from 7 a.m. to 7 p.m. We are doubling down our efforts in partnering with Miami-Dade County so that we have pop-up vaccination sites at all of our campuses. Our students are launching a campaign, Get the Shot campaign, so that they can, within each other, promote getting vaccinations as well. And we, alongside with our university partners, strongly encourage those that have not been vaccinated to get vaccinated, and those that are even vaccinated, when in close proximity to others where social distancing isn't available, to wear a mask, and that helps us protect one another. We will get through this together, and it'll be with self-responsibility and commitment to taking care of one another. And Miami-Dade College is proud to continue to be alongside the county and our sister institutions in doing so. In Spanish, buenas tardes. El Miami-Dade College sigue muy seriamente mirando los números sobre el COVID-19. Seguimos con las vacunas en nuestro recinto del norte. Ese fue un sitio en cual hicimos 350,000 vacunas en los últimos cuantos meses. Ese sitio sigue de 7 de la mañana a 7 de la noche para hacer las vacunas. Vamos también a hacer vacunas en todos los recintos, y el COVID testing lo estamos haciendo gratis en el North Campus, Wilson Campus, también en el Kendall Campus y el Homestead Campus. Queremos recordarle a todo el mundo que, por favor, si no se han vacunado, que por favor se pongan la vacuna. Juntos podemos superar esto. Gracias.
Muchas gracias. Thank you very much. We're going to hear now from President of University of Miami, Julio Frank.
Thank you. I join my colleagues in applauding the initiative from Mayor Levin Cava to bring us together, because in a pandemic, no one is safe until everyone is safe. And we are entering into unfortunately a scenario that was predicted, that with ongoing transmission around the world, the likelihood of a rise of new variants was very high. And this is exactly what we're witnessing. And I think this should be a reminder about the importance of getting everyone vaccinated. It will not only protect us from the current variant, but also will reduce the likelihood of future variants arising. And that is critical, and we gotta act in unison. So we're happy to join the rest of the universities and colleges in our county in this joint effort. We have made at the University of Miami the vaccination mandatory for employees. And we're moving in that direction. We can't do that for students, but we're strongly encouraging them. We are trying to facilitate that so that when we expect students to start moving in, First of all, every residential student will have to be tested negative 24 hours before moving into the residential areas. And then during the week of moving and the first week of classes from the 17th to the 26th of August, we will have vaccination booths on the Coral Gables campus for all our students. Any student, residential or non-residential, who has not been vaccinated or has not provided us with the information will have to be tested at least once a week so that we can keep everyone safe. And based on the very successful experience we had during the last academic year, where the university managed to stay open for in-person instruction throughout the fall of 2020 and the spring of 2021 with zero cases of in-classroom transmission of the virus. We are now requiring again, based on that experience, that all students in classroom and faculty will have to mask up. And we hope this will be an incentive for everyone who's still hesitant to get their shots, because once we reach everyone vaccinated on campus, that will not be necessary. But while we are not yet there, that is an additional precautionary measure in addition to the constant testing and contact tracing like we did last academic year. Quiero sumarme a mis colegas presidentes de las universidades y colegios del condado en agradecerle a la alcaldesa Levin Cava que nos haya convocado. Este es un esfuerzo colectivo porque en una enfermedad infecciosa nadie está seguro hasta que todos estamos seguros. En la Universidad de Miami hemos hecho obligatorio la vacunación para los empleados. No podemos hacerla obligatoria para los alumnos, pero sí lo estamos alentando de manera muy vigorosa para que lo hagan. Estamos requiriendo a todos los estudiantes residenciales que se sometan a una prueba negativa, que presenten una prueba negativa 24 horas antes de mudarse a las residencias. Y después vamos a tener lugares de vacunación en el campus durante la semana en que se están mudando y la primera semana de clases tendrán la oportunidad todos de vacunarse. Después de eso, los estudiantes residenciales y no residenciales que no estén vacunados tendrán que someterse a pruebas diagnósticas al menos una vez por semana. Y finalmente, dado la circulación de esta nueva variante tan peligrosa, hemos decidido reiniciar el requerimiento de que todo el mundo use cubrebocas en los salones de clases independientemente de su estatus de vacunación. Conforme más y más estudiantes se vacunen, podremos ir relajando esa medida, pero por ahora es el tipo de medidas que nos permitieron durante el año académico anterior haber estado abiertos todo el año, desde el otoño de 2020 y la primavera de 2021, sin haber tenido un solo caso documentado de transmisión en los salones de clases. Entonces, sí se puede controlar el virus, tenemos herramientas basadas en la ciencia, ahora tenemos que aplicarlas y si lo hacemos todos juntos, vamos a vencer la pandemia.
Thank you very much. We're going to hear now from President of Florida Memorial University, Dr. Jeffus Hadrick.
My apologies. Good morning, everyone. And as many of my fellow presidents have indicated that certainly this new Delta variant is imposing, again, challenges. But one of the things here at Florida Memorial and like our other universities in our communities, we're dedicated to working with Miami-Dade County and the great work that the mayor and her team are doing to counter these challenges. One of the things we're doing at Florida Memorial, while we are not mandating vaccinations, we're strongly encouraging all of our faculty, our staff, our students to be vaccinated. We are also requiring weekly testing, whether you're vaccinated or not here at the university. Students are also asked to, as well as faculty and staff, to continue to wear masks, even during classrooms or in large settings here, again, throughout the university community. We have students who are already moved in, and many of those students have, cleared, tested negative, and many are vaccinated. And the good thing that I like about the fact that we are constantly promoting the importance of getting vaccinated. And we have now begun to see a significant number of students requesting us to continue to, offer more vaccinations here on campus. And so, again, I'm looking forward to working with the mayor and her team, to host a site here and other initiatives to not only vaccinate our current students, but even our community and many of the parents as of our students as well. So thank you, Mayor, for the great work that you continue to do in this area.
Thank you very much. I want to invite any other leaders that are on the call that would like to give a comment.
Sure. This is Bruce Smith with Fortis College down in South Miami-Dade. I wanted to say thank you, Mayor, for putting this together and the team coming together to do this, because it is important to all of our community. And I know firsthand in South Dade, this is huge in making sure, our college is fairly small. We currently have 91% of our faculty and staff that are already vaccinated without mandating it. And we know with our students continuing to talk about this. And so we continue to push our students to ensure that we have masks in class, that we're on campus and being safe. We've had 3 vaccination mobile sites come to our college already throughout the pandemic since March. And we look forward to partnering with the county as well to make sure that we have access to not only just our student population, but the greater community at all. So thank you for putting this together and being able to be a part of that.
Well, thank you very much. With that, we're going to open for questions from media. If you have any questions, please raise your hand and I will call on you. When your mic is open, please introduce yourself with your name and your media outlet and the person you're addressing the question to. So we're gonna call on Greg Allen first.
Hi, yeah, this is Greg Allen with NPR. It's a question for President Frank. You said that you're not allowed to mandate vaccinations. Can you explain what's going on there? Would you mandate vaccinations for students if possible? And if so, and if you can't, why not?
But the reason is that there's legislation in the state of Florida that does not allow any service organization to demand proof of vaccination in order to provide the service. And that includes institutions of higher education, including private ones like the University of Miami. So we're not allowed to require it, but we can require it from employees, which we're doing, and we can strongly encourage our students to do as well. And we're quite hopeful, given the type of students we bring here, which it's a self-selected group. They wouldn't come to a research university. They didn't believe in science. So we're quite hopeful that the exhortation will work and we'll get acceptable levels of vaccination in our community.
Thank you very much. Calling on Doug Hanks.
Greetings. Could I ask a question to the mayor? Can you tell us what your survey is showing from vaccination results from county employees and whether or not there's any discussion of mandating vaccines for the county workforce?
Thanks, Doug. I believe that you got those results. No? We're sending them to you shortly. But basically, for those who've responded, it's about an 85% across the board vaccination rate, which we find very encouraging. And yes, we're considering other opportunities, but haven't yet determined anything additional that we would do at this time.
Thank you very much. And as a reminder, if you have any question, please raise your hand. And when you're called on to ask your question, please say your name, the media outlet that you represent, and who you're addressing the question to. We're calling on Ana Claudia Chacin.
Hi, everyone. My name is Ana Claudia. I'm from the Miami Herald. This question is for the mayor and possibly Dr. Peter Page. So we're undoubtedly seeing a third wave in COVID cases in Florida. Arguably, this has been the fastest spike we've seen since the beginning of the pandemic, and experts attribute this to the spread of the Delta variant. But something that's different this time around is that we're not seeing those daily case counts at the county level, just weekly, because that's what we're getting from the Department of Health. And the daily reporting of hospitalization data at a county level has somewhat filled that void. But how does this lack of daily data from the state affect local level decision making? And how does that differ from the decision making process the county had in January? Thank you.
Yes, thank you for the question. And we, of course, are data driven, science driven, and it is very much contingent upon the data that we can receive. So we would want the state to provide us more frequent information. We have started our daily dashboard back up with the data we're getting from the hospitals and any other data points that we can find. We would wish for more frequent reporting from the state so that we can do a better job of being on top of the daily numbers.
Thank you very much. Calling on Doc Hanks.
I'm sorry, I was on the wrong screen. So I just want to follow up if I could, Mayor. You said that other options are on the table. Does that mean that some sort of vaccine mandate is a potential option for the county workforce?
So Doug, we're just exploring every possible avenue. We're very, very concerned about the spread, crossover as well. So we're very, very eager to reduce the spread, and we're looking at every possible option.
We have one question from Patricia Massey.
Hi, thank you. This question is for Dr. Frank and the other university presidents, but just given your professional background, Doctor, are you sort of planning for the long-term living with this virus? What does that look like in a university setting? Is this going to be every year that we sort of go through these ups and downs and we just have to prepare for this being the normal that we face in the coming few years?
It's a great question. It really depends on what we do now. Really depends on what we do now. If we can get everyone vaccinated, and not just in the United States, but around the world, but let's start with the United States. I mean, we have the vaccines. This is not an issue of lack of availability, which is the problem in the poorest parts of the world. This is a question of misinformation. And if we can get everyone vaccinated, we will finish the pandemic. There's no question. The vaccines are highly effective. We're seeing, I mean, you know, as has been said many times, the current wave is a pandemic of the unvaccinated mostly. And so if we do that here first, and then we help the rest of the world to get vaccinated, there will be no more variants, and we will get over the pandemic by this time next year. If we don't do that, there will be other variants, including potentially variants that will completely force us to start all over again with vaccines. So the answer is, it depends on what we do now. And that's why the message has to be that everyone needs to get a vaccine. They put themselves at risk, at huge risk. Practically the vast majority of hospitalizations and deaths are happening among unvaccinated people, and they put everyone else at risk as well. So I think that's the clear message.
Thank you very much. We're going to open for some last questions. Ana Claudia Chacin.
Yeah, so I just kind of had a follow-up about how this lack of data is affecting local level decision making, and as it compares to January in terms of, you know, announcing new restrictions or advice you're giving to your residents, all of that.
So We have some additional restrictions from the state that are posing barriers. We have the ready availability of vaccines. We have the crossover infections, and we have the alarm, I would say, that is resulting from Delta being much more transmissible. That is helping to spread the word as well. So we have a lot of new factors, and we're all trying to navigate this best we can to protect people and not stop our economic recovery at the same time.
Thank you very much. We're going to open for 3 last questions, and then we're going to have to end the call. Leanne Morejon, I hope I said it correctly. Please remember to say your name, your media outlet, and the person you're addressing the question to.
Yes, you said it very well. Leanne Morejon from WPLG Local 10. This is a question for particularly Dr. Page, perhaps the mayor can weigh in as well. Are we seeing an increase? Well, we're hearing from other organizations that there has been a notable increase in vaccinations lately, particularly in the school age group, the adolescents, the teens, perhaps because we're upon the start of the school year and parents might want that vaccine to kick in before the start. Are you seeing that? And what can you tell me about that data? Thank you.
I'll start. Thank you. Since July 21st, we've seen an uptick in the number of first doses being administered at county vaccination sites. I don't have the age distribution data, but it's almost running on a daily basis twice what it was previously. And so we have definitely seen a more recent uptick in first dose vaccination administration across the county.
Thank you very much. The 2 last questions, Brooke. Brooke, we can't hear you if you're speaking. Your microphone is open, Brooke, now. In the meantime, let's open up for Doc Hanks, and then we'll go back to Brooke.
Hi, if I could just ask, guys, if I could ask Dr. Frank, did you say you would mandate student vaccinations if Florida law allowed it?
In addition to being university president, it does happen to be the case that my field of specialization, I'm a doctor, a physician, and then I did do a doctorate in public health, and that's what I've devoted my life. I've worked at the World Health Organization and was Federal Secretary of Health of Mexico for 6 years. So I am, strictly speaking, from a technical public health point of view, yes, I would mandate vaccines. We do that for many, many other diseases. That's the reason why there's no smallpox in the world since the 1970s. That's the reason we don't have polio. We mandate vaccines for children to enroll, and we've been doing that. There's ample precedent. Vaccines protect the person who gets the vaccine and protects everybody else. So I think there's a clear precedent and ample evidence that in the face of a contagious disease, mandatory vaccination has proven to be the main driver for the growth in life expectancy that we've experienced since the second half of the 20th century. If you have to point to one factor, it is vaccination. It's the most powerful tool we humans have invented, and we should deploy it. And that is, a professional point of view. As a university president, I will and always obey the laws that are legislated in our state and federally, and we comply strictly with all laws and regulations. And that's why we're not mandating the vaccine, but we're working. We are creating incentives. We are thinking about, appropriate rewards for students who get the vaccine. very much in keeping with the university culture. And we are requiring all students who choose not to get vaccinated to be tested at least once a week. Talking about asymptomatic, obviously everyone who's symptomatic has to be tested, but asymptomatic students, everyone will have to be, if they are not vaccinated, they have to be tested. And obviously if they test positive or if they are a close contact of someone who tested positive, they will have to quarantine as appropriate.
Thank you very much. And we're opening for the last question from Brooke Schaefer. Brooke, I hope we can hear you this time. Brooke, are you there? Okay, we might be having some issues from Brooke. Well, I think we're going to conclude the Q&A right now. If you have any follow-up questions, feel free to email me, natalia.jaramillo@miamidade.gov. We're also going to have a recording to share for TV stations and other reporters that need it. And I can send it to you via email as well. It's natalia.jaramillo@miamidade.gov. I'm gonna give it a moment to the mayor to give some closing remarks. Mayor?
Thank you, Natalia, and just thank you so much for the leadership in this community. We are all working together. We are unified. Together, we will be able to beat back this pernicious plague on our community and the world, but we really need to have all the tools at our disposal. I'm very grateful for all the steps that the universities are taking and the colleges, and gratitude to Dr. Peter Page for guiding us as well. Thank you, everybody.
Thank you very much.